Hi, everyone. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today is Tuesday, August 24th, and I am here to give you the update of the COVID-19 pandemic on Mobile County. So let me just put these papers down from yesterday, and thank you, Mark, for the new papers. So today we're reporting on 60,790 cases of COVID-19, and this includes 376 cases that were reported yesterday. Cumulative number of people that have died is 984. 16 additional deaths were reported yesterday. If you remember yesterday when I was looking at the daily report and comparing it to the weekly report, I noticed that there was something not quite right about those two. So our Tommy has gone back to take a look at those, and we will make a slight adjustment to the expanded weekly report. So we feel confident that this daily number is correct. 984 died, 16 new deaths reported to us yesterday. These might not all have happened in the previous 24 hours. As you know, there are sometimes delays in reporting, particularly over the weekends. So we probably will see that those were spread out over the last few days or maybe a week or two. The cumulative number of people hospitalized with COVID is 7,529. 76 new people were hospitalized yesterday. That's a rather large number, but the overall net change went down again, which is good news, that 425 were reported hospitalized with COVID yesterday. So again, that is 4 days in a row that we've had a small but very important reduction in the number of people in the hospital. I don't want to downplay what's happening or maybe upplay what's happening. Yes, we are pleased that things are moving downward, but we still are at or over capacity in our hospitals. We still have record numbers of people hospitalized with COVID-19. 85% or more of them are unvaccinated. They are younger people, younger populations than we have seen previously, and many of them are critically ill, including children. So again, we are hopeful with the direction that the number of cases and number of hospitalizations are going. They are trending down slightly, but it's not over yet. So please, continued vigilance with wearing your mask and distancing when you are around anyone that you don't know or doesn't live with you, particularly when you are indoors. Delta variant is no joke, and it will spread rapidly in largely unvaccinated populations at indoor settings, schools, churches, basketball games, parties, jumpy houses, social events, festivals, theaters, indoor concerts. All of these things have the potential to be, little super spreader events within that microcosm. When you have low rates of vaccination and large numbers of people inside and many of them not masking and distancing, that is a ripe environment for COVID transmission. So again, we're glad that things seem to be trending slightly downward. Hope it continues. You have to keep doing your part for us to get there. We're going to continue to see probably a large number of deaths, as we know that the number of deaths lag behind cases and hospitalizations. So it may continue, the number of deaths may continue to grow. So a couple of things that I wanted to speak to. Let's see. I've been asked a couple of questions that I put off for a day or two, so I want to get back to those. A few days ago, I was asked, what was I asked? Hearing that whether or not schools are required to report their COVID numbers, especially private schools. So Dr. Scott Harris, the state health officer, sent a letter to superintendents last Friday, think it was last Friday. It might have been a week ago Friday. Basically, that reminded anyone in the state of Alabama, healthcare providers, daycares, schools, that anyone knowing of a patient or a person with COVID-19 is required by law to report that to the state health department using the COVID-19 report card. So this is definitely true. Whether or not that schools are going to be required to the Department of Education, I'm still trying to nail that down. One of our infection control nurses is helping me with that. I'll let you know. Department of Education generally does not mandate private schools. So private schools that are outside of the State Department of Education would still fall under the state law that requires COVID-19 reports through the COVID-19 report card. I also was asked what percentage of people hospitalized are 12 and under, and that percentage has been pretty stable at around 5%. Something else I wanted to mention yesterday, we talked about the fact that Pfizer has approved the COVID-19 vaccine for patients 16 and over. And I just wanted to mention that it has a FDA. What did I say?
Pfizer approved.
Oh, say Pfizer. FDA approved the Pfizer COVID-19 vaccine. Thank you, Mark. And I think I was nervous because I'm about to try to say this brand name. It's called Comirnaty. Say it with me. Comirnaty. Comirnaty. And that name comes from a combination of from COVID, mRN from mRNA, and T from community or immunity. So Comirnaty is the brand name now of the vaccine that we have very lovingly been calling the Pfizer COVID vaccine for some time now. Now that it's FDA approved, it has a fancy name. Still effective, still the same vaccine. All right, a couple other things just to touch on, kind of in the, new information, trying to dispel misinformation, trying to squash rumors and provide you the most credible scientific information available to us. The Alabama Department of Public Health released a news release today strongly urging COVID-19 vaccinations for pregnant women in all stages of pregnancy and while breastfeeding. So again, stating that the American College of Obstetricians and Gynecologists and the Society for Maternal Fetal Medicine, two leading organizations which specialize in obstetric care, have recommended that all pregnant individuals be vaccinated against COVID-19. Have strongly urged all pregnant individuals, along with recently pregnant, planning to become pregnant, breastfeeding, and other eligible pregnant women to be vaccinated against COVID-19. That, with cases rising as a result of Delta, the best way to protect against potential harm from COVID-19 infections for you and your fetus is to be vaccinated. There is strong evidence demonstrating the safe and effective use of vaccines in pregnancy from tens of thousands of individuals over the past several months. So, and also the low vaccination rates, particularly in pregnant women, very concerning, causing these two societies to restate the importance of a vaccine in pregnancy. So just want to continue. Please, have we posted this on our Facebook, or can we?
Not yet. It hasn't been posted.
Okay. So Mark will get this sort of reposted on our Facebook so that you can see this if you did not see it in its primary form, just to make sure that everyone understands that the risk to mom and fetus from having COVID is greater than any risks from mom or fetus to getting vaccinated. All right, a couple of other things. We've talked about this on several occasions, but Dr. Bert Eichschild, our health officer, wanted me to remind people, to tell people, do not take animal drugs. This is a really bad idea. Do not take animal drugs. So we've had a couple of questions about ivermectin, about, some reports in fringe journals saying that there may be a benefit. But again, the agricultural version of ivermectin is for your horse and your cow and your dog, not for humans. So do not take drugs intended for animals. There was also have been some reports that calls in Alabama over ivermectin poisoning are on track to triple in 2021, according to the Poison Center. So the Poison Call Center has gotten 3 times as more calls this year as it did last, reporting, people reporting poisoning because an ivermectin intended for animal use being taken by humans in some form, thinking that it might be a treatment for COVID. It is not a treatment for COVID. It is a treatment in animals for parasitic worms, and it has some topical and some one form of medicine where it's used for humans, but that's the human version. That's FDA approved for scabies and I think head lice, but not the agricultural version should not be taken by humans. There's a lot of misinformation out there that says that it's okay to take large amounts of ivermectin, and that is just wrong. So do not take animal drugs. Best way to protect yourself from COVID is to get vaccinated, wear a mask, and distance yourself from others. We've gotten a lot of questions about vaccine requirements in different locations. So Mark printed a couple of these out. In New Orleans, Louisiana, some bars and restaurants are asking for proof of vaccination before they provide services to people. There's been lots of talk about certifying vaccine cards and what that means. New York has now done things like, ordered vaccine for restaurants and schools and that sort of thing. So we're seeing a lot of this going around, right? But so for Alabamians, remember that the Alabama state legislature passed a law that says state and local government entities cannot issue or require vaccine passports. It passed on May 17th, and it prohibits some of the things that we see happening in other states. I'm not saying that's a good thing. I'm just saying in Alabama, things that are happening in other states, please refer to this bill that was signed into law by the governor that says things like state and local agencies cannot issue vaccine passports or any standard document for the purpose of certifying an immunization status. They cannot require publication or sharing of immunization records. They cannot require a person to receive an immunization, or state and local agencies cannot require a person to receive an immunization or document immunization. Colleges can require students to prove vaccination status, but only for vaccines that were required prior to January 1. And businesses cannot deny customers goods or services or deny entry into any place of business because of vaccine status or because of lack of documentation of vaccine status. So I just want to make sure if you see or hear about things that are happening in other states that have to do with vaccine passports or requiring vaccines and that sort of thing, please refer back to the Alabama state law that was signed by the governor very early summer that has limitations on what Alabama can do to require vaccine and to require documentation of vaccines. If we need to go over that again, we can talk about that another day this week. There has been some talk nationally about whether or not there's going to be a federal or a national um, certified vaccine card. What I'm hearing through CDC is that this is not going to happen. Some states have electronic system by which they have electronic certification or just kind of a double check that a vaccine document has not been forged. Most people are still using those small white CDC vaccine cards. So while Alabama, there are few circumstances where those can be required. Just be aware that if you go to other states or if you travel or go outside of the country, the laws are usually much more strict. They're definitely different, but you'll have to check with, particularly if you're traveling, check with your destination to determine if you will be required to provide documentation of vaccination or even testing prior to entry, because we don't want you to get there at customs in another country and realize that whatever you brought to show for documentation is not good enough for that country. Some states are doing things like where their card has a QR code and you scan it and kind of takes you to an electronic verification, but Alabama doesn't have anything like that. Not sure if we will. So please maintain your CDC, that white card that we give you about vaccination. Okay, I was going to talk today more about vaccination for pregnant individuals, but I think we've covered that already. If you have questions about vaccination, please put them in Facebook, and I'll try to address those later. All right, here are some questions. Someone's asking if the health department is aware of any hospitals in the region requesting the use of a temporary morgue. I have no direct knowledge of that. Not in Mobile County, as far as I know. I have not heard of any hospitals requesting assistance with temporary morgues. It is fairly common in an emergency situation to have temporary morgue or temporary autopsy situations. It's not, particularly when you have a large number of deaths or a surge in deaths at one time, it is not unprecedented that temporary morgue services will be used, storage of decedents until they can be processed by local funeral homes. It does happen, unfortunately, from time to time. All right, here are some questions from Facebook. Can I get a second dose of Johnson & Johnson vaccine now that Pfizer and Moderna are getting a third dose? So a second dose of Johnson & Johnson has not been authorized by FDA. Do the numbers in the daily report reflect both positive PCR and antigen test? So it reflects both the confirmed, so cases confirmed by PCR, and probable cases confirmed by antigen tests are counted in our daily report. Someone asking if you're eligible to donate plasma after having COVID, is this the same as being fully vaccinated? And the answer is no. Any immunity or plasma that you have following a natural infection is not a substitute for vaccination immunity. It does not count for being fully vaccinated. Someone asking about when people test positive with a rapid test and then get another type of test and find out that they're not positive. So this does happen sometimes, particularly if you get tested today and then, if you get tested several times in a short time period, you may have swabbed your nose so that your swab no longer has enough viral particles on it for you to test positive. In general, it's not a good idea to get 2 or 3 tests in the same day because the specimen is collected by a different person, sometimes with a different type of swab. Again, you're swabbing the same space. The tests are all different formats and they respond differently. So it's not a good idea to get several different types of tests in the same day, or get one today and get a different one tomorrow. It's extremely difficult to interpret test results like that. In general, if you have symptoms of COVID and you've been exposed to COVID, so you have a very high probability of testing, your test should be positive. If it is negative, then maybe you want to flex to a PCR test. On the other side of that coin is if you've not been around anyone with COVID and you don't have symptoms of COVID, and for some reason you test and you test positive, that is more likely to be a false positive, and you might want to flex to a PCR test. But having several different antigen tests or several different rapid tests is not a good idea. So a rapid or an antigen test should only be confirmed or refuted with a PCR test. So someone asking, when can you be around someone that's had COVID? 10 days after they tested positive or 10 days after their first symptom onset, as long as on day 10 they are don't have a fever and have returned to normal health. 10 days after having COVID is when you can be around them again. So someone asking that when they test positive for COVID, they're upset that they're not getting any medication. Do I have any suggestions for people to treat them at home? There are some, there have been some suggestions that maybe vitamin D or other vitamins might help you feel better, a little bit better. But sometimes these things just help you feel better, don't necessarily help you fight off a COVID infection. I think, Mark, what I need to do is print the IDSA guidelines on treatment. I mean, very few FDA authorized treatments for COVID are available, and those are to hospitals or healthcare personnel. There are some things that might help you feel better, but it's really treating your symptoms, not treating your viral infection. The things that treat that viral infection are required to be administered by healthcare providers and not to be administered at home. Do I have any data for about hospitalized vaccinated individuals that are in ICU? So, as I said, 85% of people in the hospital are unvaccinated. The 15% that are vaccinated and in the hospital, most of those people who are vaccinated have immunosuppressive conditions or underlying medical conditions that make them susceptible to severe disease once they get COVID. So again, the 15% in the hospital that are vaccinated are more likely to be moderately or severely immunocompromised, so they did not mount a good response to the vaccine when they received it, or they have underlying medical conditions that made it very difficult for them to fight off that infection. They were predisposed to severe illness of COVID. All right, do we want to take any questions? All right, so I think that's it for today. So again, if you have questions about pregnancy, if you're just not sure, please let's have a conversation about that. We've had deaths in several pregnant females in Mobile County, and it is just devastating to their families who usually, lose a young mom and an unborn child at the same time. So please, if you have concerns about vaccine and pregnancy, please talk to your healthcare provider, to your obstetrician, to your trusted friends, or ask me. You can send an email to covid19@mchd.org. So last but not least, don't take drugs intended for animals, and get vaccinated, wear your mask, keep your distance from people that you don't know, stay at home if you're sick or if you've been exposed to someone with COVID. Stay safe, and we'll talk again tomorrow.